Who has it better than us?
Nobody!
Who has it better than us?
Nobody!
Who has it better than us?
Nobody!
There's 5,500 hospitals in the United States, and we work with about 2,500 hospitals. And your hospital rates in the top percentile of all of our hospitals across the country. And you did it, you know, just in the last few years, and you really made that progress, and it's a big commitment to do. And everyone else is committed, but you got there.
As Eva mentioned, this puts you in the 99th percentile. This is like an amazing, you know, I mean, 99th percentile, not too many hospitals reach that.
It's just a very friendly environment, a compassionate environment, and I think that's what will lead the charge. It's not focusing on moving from 70 to 75, 75 to 80. It's focusing on doing the right things, and there are a lot of people that are focused on those key behaviors, you know, listening to people, making sure they understand you, making sure that they feel like you're there to take care of them, and that's just the feeling you get when you walk in the door.
It's a culture of doing what's right for your patient and including your patient in all aspects of the care.
Because we've been there a long time, we are like family. And when you come to see us, there is that sacred hospitality of coming to be taken care of by people who care for each other and care for the patients that we take care of.
It's a testament to the compassionate care that our staff has given. I've seen it in my peers, I've seen it in my employees, I've seen it as a patient, as a mother, as a grandmother.
I mean, this award is really exemplifying us working as a system. And that system has so many parts. Like you say, the nursing is such a keystone to patient care. One of the things that has allowed us to be there for 130 years is innovation. So in many ways, we're always looking to do better. I mean, right now, we've been working together for the last, you know, you and I personally, and Michael and I, and Norma, and all of us, we work to see, gosh, these are things we need to work on. We're always looking on how to improve.
When you come into Napa Valley to St. Helena Hospital, no one is a stranger to us. And when we work our shift, when we leave our hospital, we go back into the community. So the people we care for, they are our family, they are our neighbors, they are our co-workers, they are our peers, they are our donors.
The Cancer Center is a great example of how the community and the donors that donate to our hospital have gotten involved and helped improve our hospital and get our hospital to where it's at.
When you use an emergency department, the thought of even going to one, really you have to think for a long time, because what it may end up meaning is that you're stuck in a crowded room for 5 hours before anyone will pay you any attention. And that's not the case at our emergency department at St. Helena Hospital.
The Kuhn Joint Replacement Institute is a special place because they do incredibly innovative surgery in such a way that patients leave the following day.
Our family birthing unit gets rave reviews from everybody I talk to. There's people that pass up other hospitals to have their babies at our hospital.
The Heart and Vascular Unit, it's a wonderful place to work because the people that I work with every day make it fun, make it exciting, make it challenging to come and work every day. And that flows into the patient care, where we all, as a team, it's not your patient, it's not my patient, it's our patient to help.
I remember a time we had, someone came into the emergency room at his wife's urging because he had indigestion, and you were on that day, Rob. And the patient's heart stopped more than 10 times. And you were persistent. And we all did work together in our cardiac service line to get that patient to the emergency department, get him taken care of, get him to the cath lab, open up that blood vessel to reperfuse his heart, and allow him to go home and be well.
And been Seventh-day Adventist has given me the opportunity to share my faith with others, allowing them to pray with them, allowing them to have the chaplain come and talk to them. That's given me a satisfaction that I haven't been able to encounter in other fields of work.
My job isn't just a job or a profession, it's a vocation. When I was young, I always thought I would be a nun, and that didn't happen. So becoming a nurse was the closest thing I could do to doing that, to living a religious life.
I remember during the Vision Bold where you were talking up front about that and saying, you know, anything that a patient needs, if they need a cell phone charger and yours happens to be the kind they need, give it to them, buy another one and give him the receipt and he'll reimburse you right away. And that empowerment, you know, number one, doing those types of things goes a long way, but that empowerment to the employees spreads more so, even, you know, giving them that power to deal with patients.
I think our mission is at the heart of patient-centered care, because a patient is not only a physical being or a spiritual being or a mental being. It is all of that together. It is the complexity of every human being that needs the power of all to be dealt with, to be treated, and to be respected. And that is something that we are encouraged to do and supported to treat the spiritual, the mental, and the physical healing at St. Helena Hospital.
That's the great thing about the hospital is that we have these specialty services, our cancer center, our joint institute, but the mission and the system of this hospital and its history also gathers and cares for our people that have trouble with alcohol, people that had trouble with substance abuse, and mental health. I mean, these are areas that a lot of these wonderful hospitals might have all these great boutique services, but what I find special about this hospital is it cares for that part of the population that, and gives them that same service level, which I think is absolutely imperative.
Helen, would you address the question to the donors? In other words, if you're speaking to a donor, why should they make contributions to St. Helena Hospital, Napa Valley, on the heels of our getting an award like this?
Because if I was a donor, I would want to know that my money is going to be well spent, that you are going to be good stewards of that money, and what more important foundation just in philosophy could there be other than patient-centered care?
We have some spectacular volunteers who, I think, Maria, you've known them for a very long time as well. Some have donated thousands of hours. And they don't want to just be at the front desk. They want to be involved in the care.
Where our system is fantastic is we see the force the entire time, because we're all communicating and we're all looking at the force of that patient, what needs to happen for a sick patient to get better. That is where, I mean, nurses and physicians work wonderfully, but maintenance makes a huge improvement. Environmental service, huge improvement. And that, I tell you what, they not only affect patient care, but directly at our facility. And I love that about this hospital.
I can call any one of our physicians if I need something for a patient. Norma can pick up the phone and call Terry Newmeyer, our president and CEO, and say, I'm concerned about this. Maria can come and talk to me. I can go to Michael. We all go to each other because we have a front line. Anybody can talk to anyone.
Hebrew Circle.
Hebrew Circle, absolutely.
Hey, all right. Who has it better than us?
Nobody!
Who has it better than us?
Nobody!
Who has it better than us?
Nobody!